Okay, hi everyone, and welcome along to this module on learning and improving, where we'll consider how we can learn from our experiences to improve our work delivery. My name is Andrew Lamb. I'm a Senior Knowledge Manager in the Transformation Directorate of NHS England, and a part of the purpose of my role is to support teams to take the time to pause, reflect and learn so that they can continuously improve what they do and how they do it. And in the context of recovering urgent and emergency care services, that means contributing to an overall purpose of improving waiting times and patient experience. So broadly speaking, these are our learning objectives for the session. Firstly, we'll consider why learning and improving are important, and then we'll have a look more closely at what do we mean by learning, and I'll introduce you to a model for learning that you can apply into your work, and then we'll look at three practical approaches that you can use, and I'll highlight where we have supplementary guidance and tools that you'll be able to access in some supplementary materials along with this presentation. So first of all, let's start with some context. So the delivery plan for recovering urgent and emergency care services was published in January this year jointly by the Department of Health and Social Care and NHS England. And against what the report describes as a perfect storm of factors that included peak concurrent COVID and flu numbers and problems in discharge that caused record bed occupancy, slow patient flow, and patients spending more time in A&E and ambulances. And so the report described an overall commitment to improve waiting times and patient experience through increasing capacity in terms of beds, ambulances and same-day emergency services, growing the workforce by enabling more clinician availability for the 111 service, introducing more flexible ways of working and increasing the number of emergency medical technicians, speeding up discharge through new care transfer hubs in hospitals, for example, expanding new services in the community, and that includes scaling up frail and falls services and greater use of virtual wards for safe monitoring in patients' own homes, and to help people access the right care first time. And as all of these things are considered, designed and implemented both locally and regionally, then it's likely that there's going to be lots of opportunity to learn from experience as insight and expertise is acquired, and therefore to improve. Equally, published in 2022, following the 2022 Health and Care Act, we have a new operating framework which sets out the roles for NHS England, ICBs and NHS providers, and it comprises a set of foundations that address why we are here, what we do to add value, how we do it, and what we need to achieve. And these apply to what's called the spheres of operations, which you can see over here on the right hand side. So that addresses both NHS England's national and regional teams, but also the ICSs in the form of ICBs and local providers. And within this model, we think there are three knowledge priorities within the framework. So that's to mobilize expert networks, learning and improving, and to share the best. And in today's module, what we're going to do is major on learning and improving, but it could well be the case that through your learning, that enables you to mobilize expert networks and to capture, document, and share your experiences as good and best practice emerges. So a bit more detail from the operating framework then on learning and improving. It's identified as a leadership behaviour and it covers two activities. First of all, learning by doing and being data-driven and evidence-based. And the practical activities that we're going to look at today are primarily concerned with learning by doing. Real-time learning is also identified in the framework as a factor in setting ourselves up for success. That's specifically to support effective monitoring and, if needs be, to course correct if we feel something is not working well. So the operating framework provides us with a purpose for learning proactively in our work, namely that it supports us to monitor, course correct and improve. And so it's an important leadership behaviour when considering the design and implementation of a new initiative. Okay, so we've looked so far at the delivery plan for recovering urgent and emergency care services and taken into account the new operating framework. So next, what I'm going to do is share with you a knowledge and learning model that will help you frame how you can learn and improve and implement that learn by doing value that we've just seen in the operating framework in a practical way. So this is a model to support projects and teams to deliver their work and results by enabling them to learn before, during and after all that they do. And in practice, that means looking for the right opportunities to access knowledge at the start of a piece of work, to apply and manage knowledge in its design and delivery, and to capture and share knowledge when a piece of work completes. And this is where knowledge can be thought of as a team's experiences, insights, expertise, collectively what we call tacit knowledge, but also any tools, processes, guidance, templates that it's used or designed to support it in its work, and that's what we call explicit knowledge. And so these two groups of knowledge might be accessed or shared in terms of the model with the displayed with the two blocks at the top. So they can be thought of more generally as content and know-how. And so these might be available internally or externally. So you're thinking here of online repositories, the external literature, through communities of practice, professional bodies, and so on. And so around that learning cycle, there are three similar but different learning by doing structured discussion activities that you can use to support your learning and improving. So that's the before action review, the after action review, and the retrospect. So I'll provide you with a quick sense of them each now, and then we'll look at them all in more detail. So the before action review supports teams when they're defining a new piece of work. Depending on the work's complexity, it might be a discussion that lasts 15 minutes, or it might go out to something like 3 or 4 hours. And its purpose is to support a team in its planning by considering, well, what do we know about what we're about to do? What don't we know? And therefore, what are our knowledge gaps? And so the outcome is to define the actions that a team needs to take to plug its knowledge gaps. So this discussion should involve everybody in a team, and it can be a great way to support that kind of forming phase that you have if a team is new. By contrast, the after action review takes place during the design and delivery of the work. It relates to the tasks and activities of that work, especially those that went either really, really well or those that really didn't go at all well. So it's intended to be a quick, short discussion, no more than 20 minutes, and it's only for those members of the team that were involved in the task. So not everyone in the team. You trust the task participants to figure out what the learning is from their experiences of that task. And by applying the learning that those people define to the team's future tasks, then everyone in the team benefits. And typically you would record and track an after action review discussion and its actions in a lessons learned log. And in the supplementary material that sits alongside this presentation, we've got a template lessons learned log that you can use. And then finally, we have the retrospect. So this occurs at the end of a piece of work. Because it involves reflecting on all the tasks and activities in the definition, design and delivery phases of a piece of work, it's a much longer discussion. Perhaps it might be between 2 to 4 hours. It should involve everyone in the team and perhaps key stakeholders as well. And because it occurs at the end of the project, then the primary beneficiaries are actually other teams, those in the future who might work with a similar scope or a similar set of stakeholders or with a similar purpose, who will benefit from your insights. And so it's a means of facilitating the sharing of learning with those future teams. And so in order to do that, you need to record the retrospect discussion in a crisp, clear manner that illustrates what the key learning points are, both good and bad, and then ensure that that report is accessible and available to those future teams as and when they need it. So together, these three activities support learning by doing, course correction, and ultimately improving. Okay, so what we're going to do now is look at each activity in more detail, and we'll start with the after action review. So that does mean I'm actually walking through these activities slightly out of order, but I'm going to do that in order that we can illustrate how we can transfer the learning from one team to and it's worth saying here that none of these activities are rocket science. It could actually mirror what you already do, but you might just call these structured discussions with different names. But sometimes it's quite nice to see them laid out in a structured way and hopefully in a way that you can easily deploy. So the after action review, or AAR's purpose, is to determine the key learning from especially successful or challenging tasks or activities. So it's the sort of activities that if you were to rate them, you would score them either a 9 or a 10, or let's say a 4 or a 5 or less. If it's something you would kind of score a 6, 7 or 8, then basically you're all good. There's no need to undertake an after action review. And the outcome of an after action review is to enable a team's continuous learning by applying the recommendations from an AAR to future similar tasks and activities. So the benefits to a team of an AAR include being able to identify the reasons why something worked and to apply that learning so you can bake it in and achieve success consistently, or enable you to identify why something didn't work and so you can react more quickly the next time those circumstances occur, and if needs be, enables you to evidence why you need to course correct. Either way, the bottom line is you are more effective and efficient, and you're kind of making things easier on yourselves over the course of a piece of work. And by undertaking an AAR, hopefully also contributes to building a team culture which values trust in one another, collaboration and openness. So the steps of an after action review for those in the discussion are to ask themselves what was supposed to happen, what actually happened, why was there a difference, and what can we learn? And by working through those questions, the intent is to identify the factors so that you can either lock in that success for the future or know how you can address, or better still, avoid similar challenges. So there are some points here for AAR participants to consider to ensure they have a good and purposeful discussion. Firstly, the AAR is a no-blame discussion. It's about enabling improvement for the team in its future. As I say, only those involved in the task or activity need to participate in the AAR, and it's only for those tasks that were either really successful or really proved quite challenging, so either end of that rating scale. Do record the after action review discussion in a lessons learned log, and in the supplementary material, as I've said, we've provided a template that you can either use or adapt. And this is important because A, it ensures that all actions are tracked, and B, it serves as a team memory in case learning gets forgotten. And lots of teams kind of do this. They're good at having the AAR, but if they don't record it, then 3 months later, they're like, haven't we done this before? This feels familiar, but we can't quite remember how we addressed it. So it's really important to record your AARs and track the actions from those discussions in a team lessons learned log, and also communicate the AAR discussion outcome, that is the key learning and recommendations, in a team meeting, so everyone in the team has heard at least once what the recommendations and changes are going to be going forwards. So that's the AAR. As I say, in the supplementary materials, you will find a template lessons learned log. Also included in there a quick start guide, which will provide you with more detail on working through the 4 steps of the discussion. And if you wish, we've also provided a report template that you can use to record the after action review. So you can use the report template or the lessons learned log. Okay, next we're going to have a look at the retrospect. So this is the discussion that takes place at the end of a piece of work and is a much more involved and longer discussion, reflecting back on all the tasks and activities of a piece of work. So firstly, purpose and outcome. Retrospects provide an opportunity for a team to take a step back, reflect on all of its key activities, tasks and events, especially those that were the critical successes and challenges. And the outcome that we look to work towards in a retrospect is a set of distilled key recommendations that similar future projects can repeat in terms of embedding success and or better anticipate and address challenges. And in some sense, if we can do this across all the portfolio of all of our projects, then we've got a developing sense of building organizational good practice. So in terms then of the benefits of a retrospect discussion, as we've said, the primary beneficiaries are those future teams who might work with a similar scope or purpose, and you want to enable them to apply your learning, to repeat your successes and anticipate and address the challenges that you've faced, and as I say, build that idea of adopting good practice. So in effect, enabling them to learn and improve. However, it's not a completely altruistic discussion. For retrospect participants, it's a chance to consolidate your key takeaways from the work that you participated in, to consider what did you learn and what might you carry forward, to remember and celebrate success, and to carry forward the experience into your next piece of work, so supporting your future selves as well. So broadly speaking, there are 6 steps in a retrospect: ground rules, context setting, then 3 exercises, which we call marks out of 10, 3 up, 3 down, root cause analysis, and then finally defining those recommendations for future teams. So firstly, ground rules. It's very important that participants feel that a retrospect is a safe place to have a purposeful and honest discussion. And being explicit about ground rules for the meeting is one way to achieve that. And the ones that we use are here on screen. And broadly, they address that everyone has the chance to participate, that we respect one another's point of view. It's okay to disagree, but do look for common ground. Be meaningful, crisp, clear with your contributions. You do find that time flies by really quickly in a retrospect. And in a way, you actually have permission to enjoy, to smile, to kind of switch off for 2 or 3 hours from the kind of day-to-day hectic that we all experience, to remember those successes and how you overcame some of the challenges which perhaps at the time felt insurmountable. So when we facilitate retrospects, we run through these ground rules and confirm with participants, first of all, is everybody happy with these ground rules? And then secondly, does anybody have anything to add? So our next step then is context setting. So this is an optional step, and it's perhaps most relevant for projects or pieces of work that have run for a long period, perhaps 12 to 18 months or more, or have had a high turnover of staff. So the purpose here is to get everyone back into the headspace of looking over all of the work of the project. And in effect, it's like a warm-up for the discussion to follow, if you like. And the way that we do this is to invite 2 or 3 people from different parts of the work or the project. So that might be a sponsor, a commissioner, a stakeholder, a customer, the program or project manager, a workstream lead, one of your business support team. And we invite them to speak for no more than 2 or 3 minutes about the work from their perspective. And they can use these questions on screen as a prompt if they wish. Some people might prepare a slide or 2 in advance. Others might talk to their notes. Some might just kind of shoot from the hip and speak to these questions as they see them. It doesn't really matter. The intent is to get retrospect participants back in the mindset of thinking back and reflecting over all of the work under review, remembering where the work started and where it kind of got to. Okay, so now we're into the first exercise proper, marks out of 10. So from this point forward, the goal is to try and encourage everyone in the retrospect to contribute. And so to enable that, we start with an individual exercise. So it's worth saying at this point, for the remainder of the retrospect, it's really important to have a note taker. So with this exercise, we give everyone 5 minutes to do 3 things. First of all, to mark out of 10 their score for the exam question. And our vanilla question is the one that you see on screen in blue. And it's usually what would you score out of 10 for the design and delivery of the project or work? But you can tweak that if you require, if you so desire. And in terms of the scoring, 10 is high and 1 is low. And then we also ask people to note down the 3 things that contributed to their score. So this is, what do you think were the main successes of this work? And then also to note down the 3 things that prevented them from scoring the perfect 10 or scoring more highly than they did. So this is the equivalent of saying, what do you think are the 3 main challenges of this work? And we give everyone 5 minutes to complete that. So at this point, if you're in a room together or if you're in a webinar, it should go very quiet and everyone organizes their own thoughts and just notes down their responses to those 3 questions. Okay, so now we're ready to move into the next exercise, 3 up, 3 down. So this is intended to be a 15 to 20-minute discussion where the end goal is to have the participants agree the most important successes and the most important challenges of this project, hence 3 up, 3 down. And the steps that we use to achieve this are to prompt everyone to, first of all, to share their scores, and then to share what they've noted as the key successes and challenges from their point of view. As people share, we will look to see if we can group related points and themes together and confirm with the group, do these groupings, do these themes feel right? And then which do you feel are the most important? So if you're in a room together, you can do this with post-its. If people noted their thoughts in the previous exercise on post-its, you can have them come up to a board and put their post-its on and then move them around and theme them. If you're in an online meeting, you can do the equivalent exercise with an online board, such as something like Jamboard. So at the end of the 20 minutes, you should have a sense of the group's thinking on key successes and challenges and have them agree what they judge to be their 3 up and 3 down. So from all the pool of everybody's thoughts, what as a group do they feel are the three most important successes and the three most important challenges? And 3 up, 3 down is a rule of thumb. It could be 2 up, 4 down, 3 up, 4 down, 3 up, 2 down, and so on. But equally, we find that capping this exercise to 20 minutes really helps to focus the mind and keeps that discussion purposeful. Okay, next we have the longest exercise of the retrospect, and it's the analysis of those 3 up, 3 down, those key successes and challenges that were identified at the end of the previous step. So as a facilitator, you ask the group to articulate the key factors that lay behind those 3 up, 3 down factors by considering what happened, why did it happen, and what was the impact. Try and ensure that everyone has a chance to contribute, and try and note down as much detail as possible. So that might include sequencing of events, understanding what lay behind some of the factors that have been identified, so that you can build up a really clear picture of the circumstances of a success or challenge. So it's here that your note taker really needs to earn their corn. As I said, this is going to be the longest part of the retrospect. We've got a suggestion on the slide here that it might take up to 90 minutes. Even then, it might not be feasible to explore all of your 3 up and 3 down factors in detail. So if time is an issue, or if some of those factors are really detailed, then it's better to explore 2 or 3 of them in detail rather than try and rush and skim over all 6. So what we suggest is you start with the most important and simply see how many you can get through in the time that you can allocate for this step in your meeting. It's worth adding, in this discussion, there's also a sense of diminishing returns. People do get tired of poring over the detail, and some of the circumstances may be the same or similar across your 3 up and 3 down factors. So that reinforces it is better to explore 2 or 3 or 4 of the factors in more detail than to try and rush through all 6. Okay, and so the final step then is recommendations. So for each success and challenge that you were able to explore in more detail in the previous step, it's now time to define the recommended actions so that future teams can repeat your key successes and or anticipate and address your key challenges. So as with the root cause analysis discussion, try and define these recommendations in as much detail as possible. So who needs to do what, when do they need to do it, how do they need to do it, where do they need to do it, and that's it. You do that for each of the successes and challenges that you were able to review in detail, and that concludes your full retrospect discussion. So because the retrospect discussion is a much more involved and longer discussion than the after action review, we have quite a number of considerations for facilitators. First of all, we found that retrospects work well both in person or online. Secondly, for that context setting step, or step 2, it's really important to invite 2 or 3 people from different parts of the work who are likely to have different perspectives. We found that ground rules are really important if you're going to have a chance of encouraging everyone to participate. If you're dealing with a large group, you might want to employ breakout rooms for the 3 up, 3 down, root cause analysis and recommendations discussion. If so, do plan some time at the end of each of those steps where each group can feed back its key points to the full group. And do ensure that when you put people in breakout rooms, that they've worked together, that there is for those people a shared context, a shared experience of the work that they can reflect and remember back over. As I've said once or twice already, note takers are critical in this discussion. So appoint note takers. Their notes are absolutely vital for the write-up of a retrospect, which you will need to do if you want to ensure that others will benefit from your discussion. And in the supplementary materials, we do have a template report that you can use. And then make sure to share your report and its recommendations with others. So that might be by posting it on a department intranet or a collaboration drive. It might be to present in a department meeting, and ensure you can post your report with your other project closure documentation, so it's there for access for future teams. So in the supplementary material, we've provided you with a quick start guide that will take you through the steps of the retrospect. And as I say, there's also a template report there for you to capture your retrospect discussion. So our last activity, the before action review. So if you remember, the before action review was identified as a learning before activity, and its purpose therefore is to help a team determine the gaps in its knowledge so that it can begin to progress the design and delivery of its work. And the outcome is a plan of action so that it can plug its knowledge gap. So that might include finding relevant tools, guidance and templates. It might be to go and talk to a neighboring provider about their experiences if they've been an early adopter or they've piloted a particular solution. It might be to go and engage with some subject experts. It might mean commissioning a library service to research evidence in the literature. It might mean reading an evaluation report from a similar project that might have completed 6 or 12 months ago. And it might mean accessing the lessons learned log or the retrospect report from a relevant recent project. And in terms of benefits then, a BAR supports the team to clarify its purpose and enable collaboration and team forming. It can bring it together as you learn about one another's insight, experiences and expertise. It enables you to access, apply, capitalize on organizational good practice, what's in the evidence base, the learning that has gone before. It should be about enabling you to not reinvent the wheel and therefore to deliver more confidently and more consistently. So like our other two activities, the BAR is a structured discussion for a team, and it explores, first of all, what are we setting out to achieve? So often this is surprisingly hard for teams to pin down. Sometimes work is defined in a hurry, things can change on the fly, requirements can go unwritten, there might be pressure to get up and running and be seen to be doing things, which can come at the expense of clarity. And we hear the lack of clarity at a project's outset is often the number one challenge that is identified at the end of the piece of work in a team's retrospect. So having the discussion here can help you nail down what is it that we're here to achieve? What are we here to do? Secondly, so what do we know and don't know? So that might include identifying one another's skills and expertise. What do and don't we know about our stakeholders, about designing and delivering our objectives? Has similar work been undertaken before? How did that go? Are there case studies, evaluations, lessons learned reports that we can put our hands on? Is there a subject expert that we can go and talk to? And as you discuss that, a picture should emerge of what you know and what you need to go and find out. And you can then put in place a plan to go and source your knowledge gaps. And as you plug those knowledge gaps, what do you expect to learn from the knowledge that you find, and how will you apply that learning into your work? So for example, if you find a relevant template, how and when are you going to use that template? So the BAR might be a 1 to 2 hour discussion, but payoff could be counted in multiple hours and multiple days down the line as you avoid the kind of school of hard knocks and trying to figure out everything yourselves. If you can tap into your existing knowledge, learning and evidence, you're going to save yourselves a whole load of time. And so in the context of our previous activities, and as I've already hinted, this can mean drawing then on those lessons learned logs and retrospects of past work so that from an organisational point of view, we're building a cycle of learning from one team to another. And so one team's after action reviews and retrospects can feed into the before action reviews of future teams. So some considerations for BAR facilitators. Firstly, basically ensure there's enough time is given to this discussion. Consider all the main phases and activities of the work and the extent to which you need to access tools, templates, insights of others, past learning, or search the available evidence base. As with the AAR and the retrospect, record the discussion, clearly identify knowledge gaps and the actions you're going to take to plug those knowledge gaps, and how, when you find the knowledge that you need, how are you going to then apply that to your work. And that includes noting down and tracking who is going to do some of those actions, when are they going to do them, and so on. Ensure that people have the skills, therefore, that they need to go and research what they need, or that you can commission, for example, your local library or a knowledge service for support, and make sure to share what you find with everyone in the team. Okay, and to close out this section on the BAR, as we did with the after action review and retrospect, we've created some supplementary materials that will provide you with a more detailed quick start guide to take you through the steps of the BAR, and there's a template report that you can use to record your discussion. Okay, so that concludes this overview of the topic of learning to support your work to recover urgent and emergency care services. So as you consider your plans, have a think about how you can apply these learning activities to your work. Do you have an opportunity in the next 3 months to have a go at an after action review, a retrospect, or a before action review? And longer term, how can you embed learning into your team, into your department, and ultimately into your organization's way of working as part of your overall approach to improving waiting times and patient experience? I've been Andrew Lamb. If you've any questions on the practical applications of these activities, you're welcome to drop me a line. The email address is there on the screen, and good luck.